First of all, can I apologize for the slight technical difficulties this evening and the slight delay in beginning? Can everyone see and hear me clearly? Yeah, just give me a thumbs up. Yeah, we're good? Okay, fantastic, fantastic. So a very big welcome to all of you. And I heard some of the chattering at the beginning. Delighted to hear the Colemans and some more of you have had the vaccine. That's amazing. Perhaps Malcolm and Deanne, just do you want to briefly tell us, how was the whole experience for you? How did it go? You're muted. You're muted at the moment. We can't hear you. Go on, Deanna, Malcolm, now you're unmuted. Go
just
for
tell
it.
you very quickly, our neighbours, we just saw outside, and they said they'd just come back from Guy's, and they'd been along there, and they, without an appointment, and they got the vaccination. So we rushed down there ourselves. When we got to Guy's, we said, where are you doing the vaccinations? And they sent us down there, gave us a number, and we had to have our NHS numbers with us. And we waited until they called our number, and they gave us the vaccinations there and then. So
how are you feeling? You feel okay?
I've got a bit of a sore arm.
No side effects that chicken soup couldn't solve.
But very, very happy to have had it.
Yeah.
Brilliant, brilliant. Okay, so let's begin on that very exciting note. I know already of about half a dozen members of the Shiur who've had the vaccine, and I'm delighted to hear that you've had it, and please God, by all of us soon. I mean, this Shiur this evening, very broadly, is to discuss the topic of vaccines from a Jewish perspective, to perhaps try and answer some of your questions. If I may just ask whoever's not muted to mute themselves so there's no echo. It's a massive topic, and actually probably a more of a series of shiurim could be given on this topic as opposed to a one-off shiur. I mean, vaccinations in itself come in all shapes and sizes. There are some vaccinations for life-threatening diseases. There are other for non-life-threatening ailments. There are also different segments of the population who might have different risks based on their age, based on their location. However, before we talk specifically about the vaccination for COVID-19, we need to begin with understanding the Torah's perspective on how important it is to take care of your general health, how much of a prerequisite that is to everything and anything we begin in Judaism with. As the verse teaches us, this importance of protecting your life. And frankly, this underpins so much of Judaism. This underpins, everything in our day-to-day life. From wearing a seatbelt in the car is a mitzvah. From being, keeping health and safety regulations, that's an ancient precept. Making sure that you're doing everything in your ability to look after yourself. Now, you will say to me, hey, but Rabbi Yoni, I've seen Orthodox Jews not looking after themselves. I've seen a rabbi smoke a cigarette. Explain that one to me. And these are baffling inconsistencies, because the Torah tells us, and perhaps we're not going to talk about smoking specifically this evening, but yes, to begin smoking now when it's so known to us, the dangers associated to us, would definitely be halachically big no-no, big problem. Because the Torah tells us in Devarim chapter 4, verse 15, you need to take very good care of your health. That is a very, very important underpinning concept in Judaism. We have to look after ourselves in every way that we possibly can. Now, guarding your own health is one thing. You also have a mitzvah to protect other people's health. So even though you may say, well, listen, I'm young, I'm healthy, even if I get COVID-19, it won't be a big deal. I'll pass. It will pass fairly easily, hopefully. You still have the danger of infecting somebody else. And that, of course, is also the mitzvah of v'ahavta l'recha kamocha, of loving your neighbor like yourself, right? Do not stand on your neighbor's blood idly, right? Do not stand on the blood of your neighbor. If you don't take care of your own health, then that is very, very dangerous. But not only that, but other people's health is very, very important. Now, you should know the concept, and by the way, just to say, the Code of Jewish Law, right, Shulchan Aruch emphasizes this as in the final discussion, the idea of putting a guardrail around your rooftop, taking very good care of that. Now, I want to explain to you that this whole discussion we're having now of vaccinations, it's not a new topic of conversation. This goes back hundreds of years. The Ramah, famous Rav Moshe Isserles, one of Judaism's outstanding halachic decisors, he writes that when a plague breaks out in a city, the inhabitants of the city should not wait for the plague to spread. Rather, with some exceptions, They are obligated to flee the city at the onset of the outbreak. Does anyone want to unmute themselves and tell me, what do you think the Ramah lists as an exception for somebody who would be exempt from leaving the city? Who would need to remain behind?
Maybe a doctor?
Correct. So a healthcare worker, somebody who's going to try and stem the tide of the plague, would be required to try and stay to help everybody and to help the wider.
The grave digger.
Grave digger, well, not necessarily, because they've got to protect their own life. The health worker is directly trying to save life and stop the plague altogether. But this is an interesting.
What happens somebody who has?
Sorry,
what happens somebody who has, for example, very elderly parents who can't be moved, and they need to be looked after?
Absolutely. So this would be a situation where you would try and do the very best that you can. But in other words, in that situation, you staying behind, you become, so to speak, a healthcare worker. You become frontline, and therefore that would be different. But when there is an epidemic, a pandemic, you have to try and do everything you can to take care of your safety, of your health, of that of your children. The Shlah, the famous Rabbi Yishai Halevi Horowitz, he writes hundreds of years ago, the parents who don't take care of their children, move them out of the city during an epidemic, they are responsible for their fate. And therefore, this is something that we have established. Judaism prioritizes to take care not only of yourself, but take care of those around you, take care of your health. That's very, very important. Now, when we talk about vaccinations, obviously it's more contemporary. Although in the 19th century, the famous Tiferes Yisrael, Rabbi Yisrael Lipschitz, he discusses the discussion then was the vaccine for smallpox. Now, at that time, there was a small risk attached to it. It was still very early on, but there was a discussion about whether a Jewish person should get that. Also, more recently, the polio vaccine, which was implemented in Israel. There was a very famous discussion with the Lubavitcher Rebbe about this. Now, what's clear and unequivocally clear, and by the way, it goes on through the generations as well. In a similar vein, Rabbi Shlomo Zalman Auerbach, who was the preeminent rabbi of the past century, he rules that one has a reasonable concern of these dangers. Right, if you have reasonable concern of the dangers of not being vaccinated, you should do so even on Shabbat. It's so important even on Shabbat. I discussed with Diane Binstock this evening. Let's imagine the following scenario. Let's imagine you get a phone call from your GP inviting you for a vaccine on Friday afternoon at 5 p.m. Shabbat's come in. What do you think, guys? Howard, you going to go? It's Shabbat. What do you reckon? You're nodding ferociously. So it's actually a really interesting discussion.
It's Pekuach Nefesh.
Is it Pekuach Nefesh? But it's indirect. It's indirect.
Potentially, yes.
No, definitely not. Definitely not. How can it be?
It can be. It could cost you your life if there's a pandemic.
Let's define
not cost you a life.
What is Pekuach Nefesh? So Pekuach Nefesh is saving a life. But the question is, to what extent does Pekuach Nefesh apply? Let me give you a scenario based on the Gemara. There's a fascinating Gemara in Shabbat that describes if you have in the street some burning coal or a burning metal rod. Now, this is a public hazard. Are you obligated to remove it on Shabbat? And the discussion of the Talmud over there is, of course, it depends. It depends if it's a direct hazard. There's a differentiation, actually, if it's obvious that it's dangerous. If it's red, burning hot in color, that's one thing. If it's white, metal looks the same, whether it's hot or not hot, then the discussion would be different. But we're going to get onto that in a few minutes. But actually, it's very interesting. The Bet Din has actually ruled that in the case of COVID-19, if your doctor offers it to you on Shabbat, and by the way, it's very likely because we know I believe it's with the Pfizer vaccine, once it's out of the box, it's got to be stored minus 70 degrees. Once they've opened up that batch, they need to use it up quickly. So the best time to do that really is the weekends when most people are available to go and get their vaccine. So it's very possible that they will require you to come on a Saturday, on a Shabbat morning or Friday night or wherever it may be to get that vaccine. And the Bet Din are actually in the process of discussing this very hot off the press topic, and they're going to actually rule that you will be able to get it on Shabbat. What's really interesting, you mentioned Pekuach Nefesh. There's an even further discussion of the Chofetz, I think it's the Chofetz Chaim. I need to just look up where I saw this. He goes on to say even further. There's an even more categoric discussion in halacha, what we call milchemes mitzvah. This is actually this was actually from Shlomo Zalman Auerbach. Sorry, he described the following situation. He discussed people taking vaccines, and he said it's not only a simply question of pikuach nefesh. When there is a public health emergency, it becomes war. We're living in war times. When you're living in war times, it changes to the category of milchemes mitzvah, and those who are in charge of managing the crisis can theoretically, according to Jewish law, force individuals to risk their lives to save the public. And that's really interesting. Now, I've got Sharon in Sweden has just asked a great question. What about driving on Shabbat to get your vaccine? Would you be able to drive to the hospital to get the vaccine? So the answer is no, but you'd be able to make alternative arrangements. So for example, and again, I'm not giving a psak halacha ruling for everyone. If you want to discuss this case by case, please contact myself or one of the rabbinic team. But you would be able to pre-arrange a taxi to take you on Shabbat, potentially, if the various factors were correct. If you had no other alternative, if they were telling you that it's now or never, if you were not within walking distance and you weren't able to walk that far, you would be able to do that. So that should not stop you from getting that. That's how important it is to get the vaccine. Okay.
So will that cover using, for example, a public transit, say a bus or a train, as opposed to a taxi?
So that's an interesting question. We want to try and evolve Chilul Shabbat at every cost. But obviously, if there's the only way you can get there is through breaking Shabbat, you would want to try and mitigate it that you're only breaking a rabbinic law. And therefore, if you have a taxi driver come, for example, when Dina went into labor once, actually it wasn't once, I think with every one of our children, we ended up going to hospital on Shabbat. Dina just really likes being in the car on Shabbat, what can I tell you? Almost every single one of them, we ended up going, it was either a full salam or the real thing, whatever it was. Now, in that scenario, we have to try our of course, a woman who's about to give birth, pikuach nefesh, you have to take care of the baby and the woman, and you have to do everything. And all bets are off, right? Shabbat is sidelined with saving a life. However, there are many ways you can try to mitigate the amount of Chilul Shabbat you need to make. So for example, instead of having to dial the whole phone number of the taxi, you can have it on speed dial 1. Or even better, you can have, if you have a non-Jewish au pair or friend or neighbor who can call the ambulance for you, brilliant. And when the taxi driver arrives, you don't need to open the door that the light in the taxi will go on, because again, you'll be breaking Shabbat. So the non-Jewish taxi driver can open the door for you. I remember a very funny scene, actually, I think it was at the Royal Free, when I had to explain to my Uber driver, I think I did it on Uber, because that was also really limited the breaking of Shabbat. I had to explain to him that he had to go and stand in front of the emergency sliding doors before me. Now, you might say, oh, I'm going too far there, but we want to try to do whatever we possibly can for mitigating the breaking of Shabbat. Okay, so that's stage one. Stage one of the discussions this evening is protecting one's health, a priority in Judaism. Stage number one is protecting one's health. That's a priority in Judaism. The next thing I want to talk about is doctors. Let's talk a little bit about doctors. I know there are many people on this Zoom who may be a doctor themselves or their immediate family are doctor members, or members of the club. I want to share with you a Gemara and Brachot. There's a really interesting Gemara. The Gemara says the following. Abaya responded and said that he taught the following based on a verse, that there is a pasuk in the Torah that teaches us, right, that you shall surely heal. In other words, there's a double expression in the verse in Exodus that you have an obligation to heal. Why does it say it twice? And the Gemara says in Brachas that the permission was granted to a doctor to heal. What does this mean? Let's explain. Rashi says over there that permission was given to doctors to heal, and we don't say that God does the healing. In other words, let's imagine a scenario. Somebody has a heart attack, God forbid, and they're lying on the floor, and their very caring spouse is standing there, and they say, oh my God, they've had a heart attack. Quick, pass me the prayer book. Let's start praying, right? We're going to say some Psalms. We'll say some Tehillim, right? No, the Gemara is saying absolutely not. When somebody is unwell, you have to give them all the medical treatment that they need. You have to do first aid. You have to do CPR, do mouth to mouth, call 999, get an ambulance, help them in any possible way you can. And then when the doctors, professionals are doing whatever they can do, then you start to pray. right? This is based on the Pasuk in Exodus. Rashi explains that on the spot, the importance of doctors. Why am I telling you this? Because the poskim have described the scenario with COVID-19 that we follow our doctors. If our medical advice is to stay home, if our medical advice is to get the vaccine, we follow it and we do it with all our heart. And that is the Jewish prerogative. That's what we need to be doing. Okay, so that's number two. So we've spoken, number one, about the importance of taking care of your health. We've spoken, number two, about doctors. Now, let's imagine a scenario where somebody says they don't want to get the vaccine. What do we say about them from a Jewish perspective? What do you think, guys? Are there any questions as well? Feel free to, if anyone has any questions, feel free to unmute yourself and ask a question.
Hi, can I ask you something?
Sure.
Can you hear me? How do you justify if it is a priority to look after our health and look after others? And I hate to be sort of, I don't know, that in Israel, for instance, the Haredis have caused a lot of problems with the spreading of the virus, as I hasten to add in England. I mean, I know for a fact that in Golders Green, minyanim were being held where they shouldn't have been, people gathering in the street, and there were lots of weddings and things like that. So if it is not what we are supposed to be doing, how do you justify that?
It's an amazing question, and it's a very, very pertinent question, and it's incredibly relevant, unfortunately, to what's going on. I've just been told, sorry, there are a bunch of people in the waiting room. I'm just going to see if I can let them in. Okay, they should all be allowed in now. Sorry about that. I'm going to answer your question in just a moment. Okay, in answer to your question, first of all, I agree with you. It's horrendous and it's disgraceful and it's horrible and it's an embarrassment. But let me tell you this, as my dad used to say to me, do you like football? Yeah, I love football. Do you like going to watch Arsenal? Yeah. When you go to a football match, you sometimes see football fans behaving inappropriately. Sometimes they swear, sometimes they spit, sometimes they have thuggish behavior. If you're sitting at a football match, watching an amazing game of football and you see somebody swear, you don't say, right, that's it, I'm leaving. I'm never watching football ever again. We don't judge football by the way football fans behave. Don't judge Judaism by the way some Jews behave. There are some Jews who let the side down. They let the team down. They behave inappropriately. They don't do what they're supposed to be doing. And I would argue with you that it's a minority. Yes, it seems like a vocal majority because they're making a lot of noise and it's embarrassing and it's picked up in the press. And I'm not excusing it for one moment. It's terrible. It's inexcusable. But don't judge Judaism based on that behavior. Does that answer that for you a little bit?
No, it doesn't. You don't explain how they can allow that to go on in Meir Shurim. They're all doing it, aren't they? It's not
well, I find that comment unfair because I don't think they are all doing it. I think it's a minority. I can tell you firsthand. My wife Dina her family, her mother's family is a Hasidic family, and some of them living in Bnei Brak and Jerusalem. Very, very stringent, very, very strict, and they absolutely don't do it. They keep all the rules very, very carefully. I think it is a minority.
So, Yoni, yeah, I mean, that really wasn't the question that you posed. It's a very difficult one. Should people have free will to do as they wish and choose not to have the vaccination, even though by not having the vaccination, they're threatening the lives of other people?
So this is a question that's hundreds of years old, and it brings me on to my next source. And I would love to be able to share the source sheet with you, but I'm going to read this to you. This is from the Magen Avraham, right? With Abraham Gomblinger. He lived in 1635, 1682. He was known as the Magen Avraham. He was a very famous rabbi, Talmudist. And he writes the following. He says, if the patient does not want the medicine, we force the patient to take it. If the patient says he requires a certain medicine and the doctor says the patient does not need it, we listen to the patient. If the doctor says take another medicine, it will work better, we listen to the doctor. Now, this is entering into the whole area of civil liberty, and to what extent does that work? But generally speaking, the Jewish law is very strict. If somebody needs medicine, we want to make sure they give it to them. Now, the question is, when it comes to COVID and the vaccine, is it considered a commandment or something that we encourage? And this is a discussion. There are those who say that actually, once a certain percentage of society has it, maybe the others don't need to take it. But the majority rule across all the poskim that I've seen is that one should absolutely be taking this vaccine. And it's really, really important. And I stress, we encourage everyone to take it. I don't know if any of you are on social media. In Israel, the chief rabbi of Israel, Yisrael Meir Lau, the emeritus chief rabbi of Israel, they publicly went to have the vaccine to lead by example and show people the importance of taking the vaccine. Okay? Because as you correctly said, by me not taking the vaccine, forget about my own health, I'm endangering the possibility of passing that on to other people. And that's a major, major problem. Yeah? Okay, let's talk a little bit more about some other aspects of this. Now, the next question I want to chat to you about is prioritizing. Now, Stella, have you had your vaccine yet? Stella, you're muted. Okay, go like that, or give me a thumbs up if you have, or thumbs down if you haven't, because you're muted. Thumbs down. She hasn't have it. Well, I think we need to sort that out, because at 104, I think you should be at the top of the priority list. And I think you told me a couple of days ago on the phone you're hoping to have it in January. But it raises a very interesting question that now that we have a vaccine and the vaccine is out, what is the priority list from a Jewish perspective? How do we decide who gets the vaccine first? Now, it's an interesting thing. If you look at different governments, they have described their ways of issuing this in a different way. In the UK, who's on the top of the list?
Elderly.
So elderly. So it actually begins with residents in care homes, many of whom should have received it, and their carers, those over the age of 80, those who are the frontline health and social care. I think, Howard, you said Seb had his vaccine today, right?
Seb had his vaccine today because he pushed himself in the line and managed to find out it was there and ran down and got it. Brooke has been told today as an obs and gynae that she is not, despite the fact she's delivering babies and actually was involved in a coronavirus case last week, she's not frontline staff and is not eligible for it.
It's ridiculous.
Well, not priority for it.
Wow.
Yeah.
Well, I hope to have it soon.
Hope so.
Gosh, that's very, very challenging to hear. But this is a real discussion, and the government have said, oh, those over the age of 80, those over 75, then 70, 65, over the age of 60, over the age of 55, etc., etc. And there's actually a graph. I think it's on the Sunday Times app. You can type in your age and where you live, and it will tell you when you're due to get the vaccine. So I typed that in. I'm due to get it in July, which is, I guess, a sign of my youthfulness, which is quite nice. But I'm not going to be getting it for a while. But there's a very interesting discussion. And I want to just raise this question with you, because in general, there are two levels of looking at this. The first level is the impact COVID-19 has had on the public. And policymakers, they need to ensure that the health system can handle the outbreak of the infection, right? Save the NHS. The second level is the specific impact on the individual. Now, from a vaccine distribution perspective, this means the following. Who do you give the vaccine to? There could be a certain category of individuals who need the vaccine more, namely the elderly, the vulnerable, those who are unwell with underlying health conditions. But actually, you could argue the best strategy to contain the outbreak would be to give it to a very different group of people. For example, you could give it to teenagers or school children who are perhaps super spreading this virus, even though they themselves are much more likely to be completely well, even if they do get COVID. So what do you say then? Do you give it to the school children or do you give it to the elderly? Because on the one hand, the school children will stop the spread of the virus. Alternatively, you may say you want to give it to those people who are most vulnerable. What role does public health take into this consideration? That's my question. Any comments or thoughts?
I think the middle age, our children should be having it, not us.
I think the big problem, as I understand it, is they want to give it to the elderly because they're more likely to get COVID and they'll clog up the hospitals, and that is going to be causing the problem. But really, it's not the elderly who should be getting it because they're going to die in any event eventually, some of them quite soon. That's why the statistics are a little bit misleading, because when they tell you how many people have died, they don't tell you how many were probably going to die within the next few days in any event.
Right.
But I personally, I don't think the elderly should be getting it. But
He says, having taken it himself.
Yes.
And Deanne, I must say, you sound like a real Jewish mother there, saying the next one on the list should be my children. That's fantastic. Well, I'll tell you something interesting. Rabbi Yehuda HaChassid, he lived almost 1,000 years ago. He lived between 1150 to 1217. And he discussed the following question. He says there are two people who are sitting together. You've got a Talmud Chacham, a very knowledgeable, learned person, and you've got an ordinary layman. And a terrorist comes in and says, we're going to kill one of you. Right? So that's the scenario. Rabbi Yehuda HaChassid writes that the ordinary person has a mitzvah to offer himself. Allow the Torah scholar to live. And we actually see an example of this in the story of Rabbi Akiva. Rabbi Akiva was the great sage who was executed by the Romans. And just before he was executed, there was a man called Reuven ben Istrobli who offered to be killed instead. So therefore, Rabbi Yehuda HaChassid, about 900 years ago, he comes out and says that you should you can volunteer yourself first. Now, why am I telling you this? What on earth does this have to do with the vaccine or with COVID or with anything? The implication is actually very, very clear. The implication of these comments is that the Talmud Chacham, the Torah scholar, takes priority. Why? Because he is a public servant and he, therefore, has what to offer the general public more than the layperson. And therefore, the individual has a mitzvah to sacrifice himself in order to protect the needs of the public. What does that come to teach us? That comes to teach us that the main concern is the concern of society. And that, I think, is very, very interesting. That when we talk about this, one side of the coin is that we really need to be concerned of stopping COVID and ensuring that it doesn't go any further. Okay? Let me share with you another fascinating discussion. The Chazon Ish, who you may have heard of, lived 1848 to 1953. He was the famous Rosh Hashiva, wonderful, wonderful, famous rabbi, lived in Bnei Brak. And he discusses the following. It's a famous case. Many of you, if you've ever heard Rabbi Tatz give a share, he often talks about this case. He describes the case of the grenade or the arrow. Imagine an arrow or grenade is pointed in the direction of a group of people, and it's likely it's going to kill all of them. Would somebody be able to send the grenade somewhere else where it's only going to kill one person? Right? So you've got that ability to deflect the grenade, but it's definitely going to kill one person instead of 10 people. What do you say, guys?
Well, he should only allow one person to die.
Correct.
So the Chazon Ish says, actually, it's not the same as the case of the terrorist that we spoke about before, because in this case, the actual act, in principle, of saving a life is an act of cruelty. Because yes, you're saving the group of people, but you're also causing somebody to die. He nevertheless leaves it an open question, because in reality, it's an act of murder when you throw the grenade to the other side. So it's obviously more of a hypothetical than a real case. But the implication, again, of this dilemma is that when we need to choose between saving one individual or many individuals, we choose the many over the individual. And the only question is whether we can actively divert one in order to save many. So again, this talks about public health and how important it needs to be. Okay. Norm, what's the site where you can see whether you can have a vaccine? I think it's the Sunday Times app. I'll try and find it for you, Norman. Okay, to conclude, we've had a bit of a discussion this evening, a bit of a quick whistle-stop tour of vaccines. We've talked about the priority of your health, the priority of other people's health. We've talked about vaccines in Jewish literature through the ages, and smallpox in the 18th century, 19th century. We've talked about Shabbat. We've talked about prioritizing. And I'll just conclude with one further discussion, which is actually really, really interesting. When it comes to charity, right, there's a famous old saying, charity starts at home. But actually, this is a Jewish concept, right? The poor people in your own city come first. In other words, in very broad terms, if somebody comes to you for charity and you've got two causes, both are very worthy causes, and one is a cause to those living closer to you, it's meritorious to give that charity to the local charity. And this extends in beyond just charity. It extends further to the concept of pikuach nefesh. Now, the question is this. I think it's in America, right? The vaccine in America, the Pfizer vaccine, they have promised to give that, to prioritize it amongst their own country, right? So the United States negotiated with the pharmaceutical company to develop the vaccine, and the government have actually partnered with Moderna. For example, the Moderna vaccine, right? That's been developed in partnership with the US government. Other companies received grants, we're talking billions of dollars to make sure this happens so quickly, but they stipulated their country will get certain priority. Pfizer, actually, they didn't take any money from any government. They only entered into advanced purchase agreements with governments. And the question is it ethical from the US government's perspective to distribute the vaccine to their own citizens first, even if it's lower risk groups in the US, beyond other higher risk groups internationally? What do you think? Do you think that's unethical?
Probably.
Any thoughts?
I think you to the Americans first.
Are there any Americans on this Zoom, just before we say anything offensive?
I don't think Lauren is, no.
It's interesting. It's interesting. Stephen, I can see Dr. Breck has just made mention that the Oxford vaccine was developed right as a non-for-profit, which is interesting. But what's really interesting is, based on this discussion earlier of what we just said about that the poor people in your own city come first, right? The Americans have no obligation to necessarily give up that vaccine because they are caring about their own. And that's a really, really important concept. Right, the Gemara quotes another discussion regarding a spring. You've got a spring that provides water for the city. If there's leftover water and it flows to another city, right? So the discussion is, can the city with the water partake of all of it if they need it for their own drinking water? However, what about if they need it for their animals? So they've got a spring of water that's giving water to their citizens. Sorry, if I can just trouble whoever that is just to mute. Sorry, can't hear everyone.
Okay.
Barry Tucker should mute himself.
Shall I just see if I can just... Yeah, so let's imagine you've got a situation where you've got a spring in the city and that's providing water to you. And then it goes off to another city, but then the other city, it's not their spring. But everyone in your city has water anyway. What about you want the water for your animals, for your laundry? What should be the priority? So Rabbi Yossi in the Talmud is of the opinion that they may use it even for their laundry, even if the other city needs it for drinking, which is actually a crazy concept. And the commentators explain that the reason why this city takes precedence is based on this discussion, right, of whether or not your own citizens become priority. Laundry arguably is a very, very basic need, and therefore we need to make sure that those people in your own city are taken care of. Others argue and say, no, well, what about people in the other city? They haven't got what to drink with. So this is an interesting discussion of vaccine distribution. I don't know about you, I found it quite unsettling when you see in that graph that they put out that the wealthy, affluent countries around the world, their citizens are more likely to be vaccinated in this year, whereas in poor countries, in certain places in Africa, it's going to take many, many years for that to actually take place. Okay.
But that's a fact of life, Yoni, I'm afraid. That is the world we live in.
That is the world that we live in.
We can't do anything about it.
Well, we need to have some idealism to try and do something about it.
There are organizations which are set up specifically to help the poor all over the world.
Sure, and it would be very admirable in any way you can contribute, donate, help in any way you can. That would, of course, be very, very admirable. So to conclude, you can see that we've just scratched the surface with some discussions around vaccinations in Judaism. It's a massive, massive topic. Clearly, the priority is saving life. Clearly, it's a very, very important imperative to try and get the vaccine. We have a certain trust in the doctors that they're doing the right thing for us. They've obviously been hugely tested. It's an incredible feat that in 9 months we've got a working vaccine around, starting to be distributed around the world. I don't know if any of you were there in Shiur on Shabbat. Diane Bislock spoke so beautifully about a member of our own community who ensured that vaccine distribution is done in a way that there's complete objectivity in all the trials, etc. I'd love to just ask if Dr. Brecker, if you want to unmute yourself and just give us a bit of an insight how things are going on the front lines. I know Dr. Brecker's very much been on the front lines. We'd love to hear from you if you are available.
Unmute. Ask me to unmute.
Hello, Yoni. Hello, everyone. Thank goodness I'm actually not directly on the front line, but I'm looking after patients who are not known to be affected by COVID, although 1 or 2 have been. The situation at the moment, well, I don't know if you really want me to tell you.
Yes, please.
It is very, 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 very bad. And everyone should just stay at home again, I'm afraid, if you possibly can. The hospitals are full now. The numbers at my own hospital of inpatients with COVID have doubled in less than a week and then doubled again in less than a week. And we are full.
Where are you?
At St. George's Hospital in South London. The situation will not get better for several weeks. It's going to stay like this for several weeks because the numbers are just rising very, very high. The situation with vaccination is going very well, however. St. George's is one of the South London hubs and are vaccinating 12 hours a day, 7 days a week, including Christmas Day. I was lucky enough to get a first dose of vaccine because I'm considered high risk, just based on age and being male. That's apart from care home staff and patients and hospital staff, that's the way it's being done at the moment. And hospital staff, it is only high risk. So even if you're on the front line and you're a low risk individual, at the moment the vaccine is not being prioritized in that way. So those are my observations at the moment. But everyone, please just stay at home, keep well, and stay out of contact with anyone at the moment.
Thank you very much for sharing your insight. And, please God, we pray and hope that this will all come to an end and the vaccine, Baruch Hashem, has been found and is being distributed. And we very much live in hope. If anyone has details of that app that I mentioned earlier, I don't know how it was on the chat the other night. Do you remember where
Can I tell you a little bit about the app?
Yes, please.
So that app is giving people dates far into the future. Basically, I think the aim is to actually do better than the app will predict, because the app is making assumptions on the rate at which vaccine becomes available. And a key for the UK is when the Oxford vaccine will be available. And if the Oxford vaccine becomes available, that can be disseminated much more widely, much more quickly. And the reason is that it doesn't need to be kept at -80. And so if the Oxford vaccine gets approval, which it may get in the next few days, then it's likely that those dates that people are getting from the app will come forward. The principle, though, is exactly as Yoni has set out. You want the key principle that's been selected is to choose those who are most likely to go into hospital and die. And the theory is that by March, over 90% of the people who are currently being admitted to hospital and dying will have been vaccinated. So that subset of patients. And that's the key. Because at the moment, the hospitals are all full. So you will not get, there's, and the two reasons the hospitals are full is that we're in December, not April and May. And the other reason is that we are trying to keep other work going as well. So in April, we stopped everything. That said, there was a meeting today at our hospital and we're stopping all clinics and all non-urgent procedures. So that's how bad it is. There's no point in trying to say it isn't bad because it is.
Wow. Gosh, we can't.
And my message to everyone is be ready when you get the call for the vaccine, go. You shouldn't really think about it, to be honest. When you just be ready for it.
Absolutely.
Because
Absolutely.
now you see, when I got it, which was in the first week, there'd only been 20 or 30,000 people injected with it. Think about it. Worldwide, it's now been given to about almost 1 million people, 500,000 in this country. So you now have data on 1 million people having it. So it's already safer than it was 2 weeks ago, if you see what I mean.
Absolutely. Absolutely.
Yoni, can I say something, Yoni?
Sure, please.
I can. I mean, Seb, sorry, just to count, Seb got the same information from Bart's just now, actually. He got an email through that saying all non-urgent cases or elective cases are being cancelled throughout the hospital. They're at capacity as well, so everything stops. But can I ask you back to her halacha question?
Sure.
So I'm actually reading here about what happened with Pope Francis and the ruling from the Catholic Church, because apparently the AstraZeneca vaccine used cells in its design, development and production that were derived from an abortive fetus. Brooke tells me actually the fetus was actually taken in the 1900s. I don't know if that's true or not. Whereas the Pfizer, BioNTech and Moderna have used a cell in it from an abortive fetus to test their vaccines. So one's used it to test the vaccines, the other one's actually used it in its design, development and production stages. Is there any issue that we have in the halacha about the fact that it's come from an abortive fetus? You can come back and give us another information when you looked it up.
It's a brilliant question. I would like to double check this, but I can tell you almost certainly it wouldn't be an issue, because again, it goes back to pikuach nefesh and saving a life. And therefore, by you taking this vaccine, you're not doing anything wrong to anybody else. I mean, the only way I can compare it to is, people have heart surgery with all sorts of valves that were done historically, pig valves that may have been done. This is never a halachic question. The most important question is pikuach nefesh and saving a life.
I mean, I suppose having the fact that the Catholic Church are actually giving the go-ahead of it, and they're not exactly in favour of aborted fetuses, I suppose we're actually more than likely.
We don't generally take up psak halacha from the Catholic Church, but that is interesting, some point to consider. Yes, no, it wouldn't be a problem.
Yoni, do we have time? I'd like to ask Stephen a question. We heard on the radio that Tony Blair was saying that he thinks that the second dosage should not be used, but given to people as first vaccination. And they mentioned the percentage of effectiveness of the first vaccine. I heard somewhere there was something you were like 91% covered with the first vaccine and only very, very minor additional percentage with the second. Can you comment on that?
Yeah, that's true. For the Pfizer vaccine, there were almost no one got COVID after the first dose. But the problem is that is a short-term solution. So although, there's only short-term data on it. So if you want to be vaccinated and have cover for at least a year, you need 2 doses. So there is very little point in giving double the number of people cover that may only last 3 or 4 months. Otherwise, you have to start again. So, but there are more knowledgeable immunologists who have actually, than me, I'm not an immunologist, they've advocated this as well, saying only give one, but there's an unknown to it. The other thing that I want to tell people about the Oxford vaccine, because we've St. George's actually has a very famous history in vaccines. One of the founding fathers at St. George's was a physician from 300 years ago called Edward Jenner. And he noted that the cowgirls who milked the cows never got smallpox. And that's how vaccination started. He realized that they were getting a mild form of a disease called cowpox, and it was protecting them against smallpox. No one believed him. And so he actually took cowpox and gave it to his son, and then injected his son with smallpox. So confident was he, and the son never got smallpox. We've been in all of the trials of both the Pfizer and the Oxford vaccine. And although the Oxford vaccine, the data is that it hasn't prevented, it's prevented 70 or 80% of COVID infections, but not 95% like Pfizer. The fact of the matter is that after 2 doses of the Oxford vaccine, not a single patient who ended up with COVID went into hospital, and no one died. So even though it wasn't necessarily 95% protective of getting it, it was 100% protective against going into hospital and dying. And if that were the vaccine that would be available, I would be first in line. I just got the one that was available. So my advice to everyone is not to worry about which one you get, and be ready for when you get the call.
Thank you very much.
Thank you.
Thank you.
Okay, can I just thank everyone for joining? Can I thank Stephen for his contributions and everybody else for their contributions? And just to say, you know, the shul is closed, but unfortunately, once again, it's very, very painful for all of us. For the 3rd time in such a short period of time, we've had to be forced to close the shul. This time we weren't forced to close it. The government allowed us to keep it open, but the decision was made because we want to be extra prudent, as Stephen expressed to us, the significant concern, and therefore to err on the side of caution. Of course, when it comes to pikuach nefesh and health, that is an incredible priority. But just to remind everyone, a couple of plugs. Number one, we're having daily services again on Zoom at 8:30 every morning. We are also having, there's an amazing conference starting this Sunday that St. John's Wood has partnered with called the Bereshit Conference. We would love you to join. Some people have written to me in the chat to ask for the name of the app, by the way. I don't know the specific name, but I've been told that if you just Google coronavirus calculator for vaccination, they'll come up with about 30 different apps that do this now. So you just Google that. But please feel free to sign into this Bereshit conference. I'm going to be one of the guest speakers on Monday. I'm talking about the subject of praying from home. How can you pray from home meaningfully? And there's an amazing lineup of speakers, not including me, some other incredible well-known speakers. I will share the link in the chat for you to book in from various eminent people around the world. So please book into that. And then next Wednesday night, we're hoping to do something a bit more lighthearted. We're going to have a quiz night, and we're also planning a very exciting Tier 4 Tasters with Tony Page event in January. That's going to be very exciting. More details of that to follow. But
are you doing your Pasha thing tomorrow night?
There will be Parsha Shir recommencing after the winter holidays, not tomorrow night, hopefully next week. But I wish everybody well, and thanks so much for joining.
Thank you very much.
Very informative.
Thank
you.
All the
Thank
best.
you very much.
All the
Thank
best.
you, Stephen.
Thank you.
Okay.
When you look up COVID-19